So how are we doing as a country? Well, there's room for improvement. This slide shows HPV vaccine doses as well as the other universally recommended adolescent vaccines, Tdap and meningococcal. And you can see on the left-hand side, those orange bars for Tdap and meningococcal show nearly 90% of US adolescents are receiving those recommended vaccines. And you compare that to vaccination against HPV, females in yellow and males in blue. And those rates are much lower. We now have over 70% of US adolescent females starting the HPV vaccine series and over 50% completing, which is similar in males, but nowhere near that 90% mark that we see for the other adolescent vaccines. So this data shows us a few things. One, this is not about access. These adolescents have access to vaccines. These adolescents are getting Tdap, they're getting meningococcal, but they're not getting all the recommended vaccines. This probably also suggests that school mandates work. Tdap and meningococcal are mandated in most school districts around the country, whereas HPV is not. And this likely motivates vaccine behavior. So this is really where we need to look at how we can improve vaccination rates among patients who are coming in for care. So let's review the most updated recommendations for HPV vaccine. And again, this data is based on those efficacy trials I showed you earlier. For patients starting the vaccine series before their 15th birthday, the recommendation is 2 doses at least 6 months apart. Target age is typically 11 to 12 years, but we can start as early as 9. Again, starting before the 15th birthday, 2 doses at least 6 months apart. Starting on or after the 15th birthday, it's the original series of 3 doses at roughly time point 0, 2, and 6 months. The vaccine has also been extended to 27 to 45-year-olds. The recommendation is a shared decision-making recommendation by the CDC for men and women 27 to 45 years of age. I will tell you purely from personal practice, I recommend this vaccine to all patients starting at age 11 up through age 45 who have not received the vaccine in the past. And we have had success with this being covered by all insurance companies, regardless of payer.